Good afternoon. Thank you for joining us today. I'm Dave Morris, Executive Director of the American Heart Association in Delaware. We're thrilled that you have joined us for today's conversation on how the American Heart Association is partnering with key volunteers and supporters to transform heart and brain health in the state of Delaware. I would also like to provide a special welcome and thank you to the Cor Vitae Society and Paul Dudley White Society members on our call today. Our Giving Society members are absolutely critical to the American Heart Association's ability to drive health throughout Delaware. I would also like to take a moment to recognize Nicole Sapio, who is our Eastern States Region Executive Vice President. Nicole heads up a truly talented team across the entire region who fight every single day to save lives. Thank you. For best sound and visual, just a couple housekeeping items here for everyone. For best sound and visual quality during today's event, all attendees' lines are auto-muted and webcam sharing is unavailable, so you don't have to worry about being on camera. If you have difficulty hearing or viewing the meeting, please try disconnecting and re-entering. We have also included a call-in number in the calendar invite in case this makes things easier for you. When asking questions, please be sure the questions are going to all attendees and panelists in the chat. And this will be interactive, so if you have questions during the Q&A portion for our expert panel, please feel free to submit those in the chat box. Just make sure to pick all attendees and panelists. I would also like to thank and recognize Tom and Robin Harvey for making today's conversation possible. Tom and Robin are President's Circle members of the American Heart Association and have made a significant gift that has launched this important campaign. Thank you, Tom and Robin, for your dedication to the mission of the American Heart Association. Sorry, I think I muted myself there. Apologies.
There you go. Thank you.
Sorry about that. The American Heart Association and American Stroke Association is not just a charity. We are crusaders, innovators, scientists, and partners. We improve the health of Americans in a variety of ways. We are the nation's leader in CPR education and training. We help people understand the importance of healthy lifestyle choices. We provide science-based treatment guidelines for healthcare professionals to help them give quality care to their patients. We educate lawmakers, policymakers, and the public as we advocate for changes to protect and improve the health of our communities. We also work with diverse partners from many sectors to build a culture of health for all. Thanks to our generous donors, we have invested more than $4.6 billion, that's billion with a B, in research, more than any other organization outside the federal government. We have funded 14 Nobel Prize winners and many life-saving research advances such as the first artificial heart valve, cholesterol-lowering drugs, heart transplantation, and CPR techniques. But heart disease remains the #1 killer in America, while the number 5 killer in America, while stroke is the #5 killer in America and the leading cause of disability. I hope that after this presentation, you'll see the impact you can make and join the fight to improve health and save lives, especially right here in Delaware. During our time today, we will not only share how the American Heart Association plans to improve Delaware heart and brain health, but also how you, our audience members, can be a part of this life-saving campaign through your support and by lending your voices. For the next hour, we will have a robust panel discussion with 4 experts who will share with us their wealth of knowledge about how cardiovascular disease and stroke have a tremendous impact on the health of Delaware residents. The panel will share how we, as the American Heart Association, and you in the audience can come together to improve Delaware heart and brain health through a multifaceted approach. With stroke impacting Delaware residents at a higher rate than throughout the nation, and with hypertension as the single most important risk factor for stroke, the American Heart Association looks to drive significant change by building 2 statewide collaborative initiatives with one goal in mind: to improve heart and brain health. Mission Lifeline Stroke is a program for transforming stroke care by focusing efforts on connecting all of the components of acute stroke care in a smoothly integrated system that reinforces use of evidence-based guidelines, measures performance, identifies gaps, and engages in improvement projects at a systems level. In Delaware, 76% of stroke patients have hypertension. Nearly half of all Americans have hypertension, and approximately half of them are not managing it. To combat this ongoing threat, the American Heart Association will be convening a network comprised of, but not limited to, local health systems, state government, educational institutions, nonprofit partners, and federally qualified health centers. Shortly, you'll hear from our panel of experts about how we will strengthen systems of care over the next 3 years together. But before we begin with our esteemed panel, I have invited a friend of the American Heart Association, Mr. Thomas Harvey, to be with us and say a few words to get us started. Tom is a native Delawarean and the chairman and CEO at Harvey, Hanna & Associates. I am personally thrilled that Tom has agreed to lead this campaign, and am grateful to he and his wife Robin for their tremendous generosity, their leadership, and their friendship. Tom, welcome, and thank you for being here today. Many of our guests with us today may not be aware of how you've been impacted by heart disease and stroke. Maybe you'd get us started by sharing a brief overview of why you're so passionate about this work?
Thank you, David. Can you hear me okay?
We can, thank you.
Good. Yes, absolutely. First, I'd like to thank everyone in attendance for taking time to join us today. I know everybody's busy, so I really do appreciate it. And I think it's pertinent for me to share with you why Robin and I have decided to invest in this effort. And we look at this as an investment, not as a gift, not as a donation, but as an investment in our community. And as such, we expect we will see returns, not necessarily directly to us, but to us, our family, our friends, our employees, our customers, our community. My family has a history of some heart disease and particularly strokes. My maternal grandmother died in 1928 from a cerebral aneurysm. My paternal grandfather died in 57, a year or so after suffering a terribly debilitating stroke. My children, my 4 kids, maternal grandfather died from a stroke, and Robin's mother, a very, very active woman, suffered a stroke about 4 years ago. And when I say active, she played golf a couple times a week in retirement. She walked all the other days of the week, at least 3, maybe 4. Had 3 holes in one in her golf career, was fit, active, had been a pharmacist, didn't smoke, didn't drink to excess, didn't have any self-destructive kinds of lifestyle issues that you would expect or think about when you think about heart disease and strokes. And this stroke that she had occurred downstate in Rehoboth, and she was taken to BB, and unfortunately BB is not a stroke trauma center, and the procedure that she needed, which was to literally go in and remove the clot, could not be done there, so she had to be transported to Christiana. It was Easter night, and the weather was bad, so helicopters couldn't fly. She was transported by ambulance. By the time all of this took place, 6 or 7 hours had elapsed, and she was, I would say, near close or very close to death when she finally got to the hospital. She showed no signs of recognizing us at all. Within a half an hour of arriving at Christiana, they had gone in and removed the clot, and it entered a blood vessel, traveled up to the heart, and literally went in with a catheter and pulled the blood clot out and could show it to us laying on a gauze pad. The neurosurgeon who did the procedure described it as a very simple procedure. Simple to him, maybe, certainly not to me or to us, but it certainly saved Carol's life. That said, she's severely affected. She'll never live the normal life that she had been accustomed to. And not only, of course, have we witnessed the change that has occurred to her, but we've witnessed the change that has occurred to her husband, Marty, and to all of her caretakers and all of her loved ones. And it's really kind of heartbreaking just to see the impact that a stroke has on any family. And so that got me thinking that with the aftermath, that in the way that it's touched Robin and touched me, we decided that we wanted to try to do our part to try to help. Initially help, the thought was to try to help with getting BB more of the capabilities that they would need to have been able to do the procedure that was necessary there. That's a much more complex question and issue, and it's finances and number of procedures, and I understand that, and we're certainly not faulting anyone or throwing anyone under the bus. But as I got talking about this whole situation with David, we decided to go after it in a much more kind of global way, with the hope that in time, BB is able to justify and find the funding to allow them to be a true stroke trauma center downstate. And so off we went with David, who I'd worked with at the University of Delaware before, and we'd done some very successful things there. And so here we are tonight. There are roles here for the American Heart Association, for the state of Delaware, for the business and philanthropic community. And together, I think we can and will get better at helping those who are already in the trenches fighting this battle by providing the tools they need to be even better than they are and to improve the prevention, treatment, and outcomes of this dreaded malady. Today, you're going to hear from a truly distinguished group of panelists. And when I get in the presence of people like this, I realize how fortunate we are to have them in our community. For all the wonderful work they do. This group is going to discuss how the AHA will help to meet our state's significant need to improve heart and brain health by launching a statewide collaborative effort to transform stroke systems of care and reduce high blood pressure for Delaware's most vulnerable populations. I urge you to listen, and with this question in mind: how can I come alongside the HRA to strengthen this important endeavor? And again, I can't reiterate or emphasize more strongly how I view this, and we view this as an investment. And from the business community, it's an investment in ourselves, our families, our employees, our customers, and our community, and in our marketplace. And so if I was a purely mercenary businessman, I would look at it and say, and I have looked at it, and I say, well, so what do I get out of it from the purely mercenary point of view? Well, if I have a healthier community, and my customers are healthier, and my workforce is healthier, and my family is healthier, the financial rewards are significant and outstanding. Forgetting all of the mercenary arguments, it's just the right thing to do. Strokes are the number 5 killer in the United States, and they're the number 4 killer in Delaware. And that troubles me that Delaware does worse than the rest of the country, because I'm a lifelong resident, born and raised here. And I don't view Delaware as being worse than anybody in anything. I really think that we have it within our power to make some significant and lasting improvements here.
Thanks, Tom. We appreciate you. And thanks for being with us today and for sharing why you're so driven to improve heart and brain health. And thanks again for your leadership, your tremendous leadership support of the mission of the American Heart and Stroke Association. I'd now like to introduce you to today's panel moderator and my colleague, Ernestine Walker. For the past 2 decades, Ernestine has been a leading voice for strategies to address health disparities and life-changing community transformation. Ernestine currently serves as the Vice President of Community Health and Inclusion at the AHA's Eastern States region, where she is responsible for developing and driving strategies for both rural and urban communities. And Ernestine also just recently has moved here to Delaware to join us as a Delaware resident. So welcome, Ernestine.
Thank you. Thank you, Dave. And thank you, Tom, for your story and your passion and your commitment. Thank you. I am delighted to have an opportunity to moderate our panel today. This conversation is needed and it is certainly timely. Some of you may know that just yesterday, the U.S. Surgeon General released a national call to action on hypertension control. So this panel today is just really, really needed. With us today is Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association, Kimberly Holmes, Clinical Nurse Specialist at Bay Health, and Dr. Ray Blackwell, Chief of Cardiac Surgery at Christiana Care's Center for Heart and Vascular Health. I know you're all very busy, so I personally just want to say thank you for taking the time to be with us today. I would also like to just take a minute of our time to encourage our audience to send us your questions via chat. And when asking your questions, please make sure that the questions are going to the attendees and the panelists in the drop-down box. Our team will be monitoring those questions and will provide them to me during our Q&A period. I'd like to just jump right in because I'm so excited about the talent and the expertise that we have here today. So, as I shared, the U.S. General released a national call to action on hypertension control. The call to action highlights that hypertension control is a national priority that requires optimizing patient care and building community supports. So this question starts with you, Dr. Sanchez. Can you provide context for hypertension control and why it's so important and how it directly impacts stroke?
Absolutely. High blood pressure, first of all, is controllable. That's one of the things that we heard yesterday from the Surgeon General. I am so proud of the American Heart Association. We were mentioned a few times by the U.S. Surgeon General because, as you know, we have written the 2017 Hypertension Control Guideline, which is what informs how we practice medicine in the United States. And he also mentioned Target BP, which is our partnership with the American Medical Association to bring blood pressure under control. The good news is we know what to do. The not so good news is that we're not doing a very good job. So one of the other things that happened earlier this week is that the NHLBI, that's the National Heart, Lung, Blood Institute, which is part of the National Institutes of Health, the largest funder of cardiovascular research, and the Centers for Disease Control and Prevention brought a workshop together to try to understand why we're not doing so well with blood pressure control. I'm not going to go there just yet, except to say that bringing blood pressure under control to 130/80 would reduce by 25% heart attacks, stroke, heart failure, would have a dramatic effect in reducing chronic kidney disease, has an effect in reducing the likelihood that a person will go on to have Alzheimer's. So blood pressure control equals a longer, healthier life for every single individual in whom we get blood pressure under control. And I am so pleased to hear that Delaware is going to take this on as a state project. So one more thing to say, think of blood pressure control as the fence on the cliff. It's the way that we can say to people, stay away from the edge. And our stroke center of care is what happens if somebody happens to fall off the cliff. We want to be able to take care of folks when they have strokes, wherever they have a stroke. But even better, we want to prevent strokes from ever happening. Blood pressure control is the thing we can do tomorrow to make a difference.
Thank you. Thank you. What I got, Dr. Sanchez, is blood pressure control equals a longer, healthier life. Thank you. Kimberly, I'll move on to you. Strokes don't discriminate. They can happen to anyone at any age, and about 1 in 4 people worldwide will have one in their lifetime. To address strokes, Delaware has done something really unique. In 2016, legislation was passed in Delaware to drive collaboration and to streamline the care between stroke care stakeholders. As the leader of Bay Health Stroke Care and the chair of the Delaware Stroke Systems Committee, could you advise us on the focus of that committee and what entities are involved in that?
Sure. Good evening, everyone. The primary focus of the committee is to be an advisory group to the Delaware Department of Public Health and the oversight of the inclusive statewide stroke system of care. All 3 counties are represented with individuals from the following entities. We have stroke neurologists, neurointerventionalists, neurosurgeons, ED physicians, all of the Delaware stroke coordinators at the hospitals, which are nurses, stroke rehab professionals, pre-hospital providers, Delaware State Police Aviation, and the Delaware Healthcare Association. The impact and collaboration within that committee is tremendous. Over the last 4 years, this committee has been able to implement and standardize stroke care in numerous ways. Just a couple examples. All 7 acute care hospitals in Delaware are certified to deliver stroke care based upon the American Heart Association and their research. Criteria was developed for the administration of the only medicine known as alteplase. People in the community may know that as TPA. We have been able to standardize the criteria to treat acute stroke across the state. So all the hospitals use the same criteria. And then all of our EMS providers in Delaware use the same assessment tool to identify stroke, and that tool is known as the RACE tool. So those are just a couple of the initiatives that we've been able to work on across the state. The continuum of stroke care, the one thing that we really make sure that we accomplish at that table is just looking at prevention. So prevention with education, with our pre-hospital, our in-hospital, rehabilitative care, and then continuing education with the committee members. Those are always our focus when we sit down and we look to new initiatives, is to just really involve that continuum of stroke care.
Thank you. Thank you, Kimberly, very much. And finally, Dr. Blackwell. High blood pressure damages arteries throughout the body, creating conditions that cause heart disease, heart attacks, and strokes. Controlling high blood pressure is critical to reducing one's chances of having a heart attack or a stroke. Dr. Blackwell, as the Chief Cardiac Surgery at Christiana Care, you've seen firsthand the devastating effects of high blood pressure. Can you talk a little bit about this? Dr. Blackwell? I think he's frozen. We'll come back to him. I'm going to move on, Dr. Sanchez, to you for the next question until Dr. Blackwell comes back. I just read that high blood pressure is the
Thank
leading.
you, and I'd like to say good evening.
You're back?
I'm still here, but can you hear me?
I hear you beautifully.
Great. So I'll try the third time's a charm. So good evening, and I want to thank everyone for joining. This is a very important issue. I know everyone's got busy schedules, so thank you for the time. I'm going to have to go a little bit over the cliff to hopefully help you understand what hypertension can do. So Dr. Sanchez, I apologize for going over the cliff. Hypertension is a silent killer. People can have it and not know about it because there are no symptoms that are specific for hypertension. But make no mistake about it, it's killing us every single day. And although we're here to talk a lot about stroke, it's important that we talk about the other diseases that hypertension can cause. So we talk about cardiovascular disease. And about 80% of the patients that I operate on have hypertension. Hypertension also causes heart failure. It's a leading cause of loss of vision, kidney failure requiring dialysis. And it also causes a fatal condition that we call aortic dissection. And this is where I'm going to go a little bit over the cliff. So the aorta is the largest artery in the body. It's muscular, it's resilient. Yet hypertension can cause it to rupture or tear. And just to get an idea of how severe this is, if you have 20 people in a room and they have an aortic dissection, 50% of them are going to die immediately. They will not survive.
I think he may be frozen. Dr. Blackwell? Okay, I'm sure he'll jump back on. I'm going to go back to you, Dr. Sanchez.
More people are going to die. So
Dr. Blackwell?
yes.
Okay.
So I'm not sure, what was the last thing you heard?
If you have 20 people in a room, half will surely, yes.
Correct. So 50% of those people are going to not survive the original incident. Every hour after that, another 2 people are going to die unless they have surgery. If you're lucky, and if you make it to the hospital, the cardiac surgeons are going to have to do one of the longest, most stressful, riskiest operations that we do to save your life. So we put these patients on a heart-lung machine. We cool them down to 18 degrees. Your normal body temperature is 37. So we cool them to 18 degrees until they have no brain activity. We turn the heart-lung machine off and drain the blood out of the body. We have about 60 minutes to replace the aorta. After that, the outcomes start to decline. This is a huge operation. The aorta in these cases cannot be repaired. When hypertension causes it to tear, it's similar to trying to sew 2 pieces of tissue paper together and asking it to hold water. It cannot do it. Imagine if hypertension can do this to the largest artery in the body, what it does to the arteries in the brain. And we don't have a bypass machine for the arteries in the brain. Once they rupture, it's done. You've had a stroke and your life has changed forever. And we heard tonight how significant these changes can be. So if we're going to have an impact on hypertension and all of the diseases that it can cause, we need to act now. Hypertension can afford to be silent, but we can't. We will die if we are silent.
Thank you, Dr. Blackwell. And what I took from that, so many notes I've taken, but we must act now. I'm going to move right on to Dr. Sanchez. And Dr. Sanchez, I just read that high blood pressure is, of course, the leading cause of stroke, and up to 40% of Black adults have high blood pressure. Some even say, and I've read this, that African Americans have the highest prevalence of hypertension in the world. Can you speak to this?
Yes, true, true, and true. All of those things are true. It's the reminder, as the Surgeon General and the American Heart Association has been saying over and over, it is time to get our collective act together and get blood pressure under control. So yes, blood pressure prevalence is highest among African Americans. Level of control is not what it could and should be. And there are so many reasons for that. But this is a crisis, but it's a crisis where we know what we need to do. We've just got to get it done. There's a couple of things I think that are critically important from the standpoint of the American Heart Association. One is that in some states, not Delaware, Medicaid has not been expanded. And so that 40 to 50, even to 60-year-old African-American, or any gentleman for that matter, or woman who has high blood pressure and is low income may not have an easy way to be able to afford medical care. The other is that among African-American men and men in general, the challenge also is, how do we get men into clinical care settings? So some of the strategies that are used are community-based strategies. We've heard talk of Ron Victor's barbershop strategies, where we train barbers to be community health workers. We train barbers how to work closely with pharmacists to be able to measure blood pressure. The clinical pharmacist can make adjustments, and without necessarily having to go to a clinic, care can be rendered, blood pressure can be brought under control. But I think even yesterday, and the work that is going to be done in Delaware, is that it will take a multi-component, multi-stepped, multi-strategy approach, when combined, will result in better blood pressure control. We know it can be done. So Kaiser Permanente in its system was able to bring blood pressure control from about 45% in its patients to close to 90% control among all of its patients. It can be done, but a system approach is the way to do it. Delaware can get this done.
Thank you. Thank you. And Kimberly, that brings me to you again. What makes Delaware unique is the stroke registry that Dr. Sanchez referenced. Can you talk a little bit about the registry and what is it? Kind of talk about it for us. You're on mute.
Sorry. One thing that makes Delaware very unique is that all 7 acute care hospitals do have the American Heart Association Get With the Guidelines Stroke Registry. So all of our data is compiled. We can look at Delaware as a state and analyze our data. The registry also ensures that we deliver evidence-based care directly from the latest research that's conducted by the American Heart Association. At any time, as I said, we can pull Delaware data just to look at the state. We can see hotspots with different components of care, and we can also look at Delaware and compare with national benchmarks. So we know where we stand with various entities, some of them being arrival mode. We can look at how our patients come into the hospital, whether it's by EMS or private transportation. Of course, what we would want is for our community to use EMS. We save time, and time is brain. In Delaware, we sit about 50% with that. And I've been in my position for 8 years. It's very hard to move people not to drive into the hospital, but we certainly try. Being discharged with the right medicines to prevent stroke. We know once you have one stroke, unfortunately, it puts you at risk to have another. So we discharge our patients on statins if needed. And then making sure that rehabilitative services are offered within 24 hours of admission. That's something else that we monitor. We know the sooner we can have our rehab colleagues get to the bedside, the least, or I should say, you know, we can decrease disability the sooner we get those rehab, you know, professionals with our patients. So lots of things we can measure that makes us great. I will say this, I'm very proud to say that Delaware is award-winning with our stroke care. Every hospital is at gold status. So we work really hard.
Thank you. I'm very proud. I'm moving to Delaware soon, and I'm just proud of all that I'm learning about Delaware. So thank you for all that you do. I'm going to go back a little bit, and this is for you, Dr. Blackwell. As a cardiac surgeon and a community leader, you've led and participated in a long-standing hypertension control program. Can you share the importance of involving the community at a grassroots level in hypertension control?
Okay. Yes. So, you know, we had a blood pressure ambassadors program. We had navigators go out into the community because we realized that what we're doing wasn't working. We can't always expect the patients to come to the hospital. They may not come for a variety of reasons. They may not come because they fear they're going to be the source of an experiment. Maybe they don't have money. Maybe it's transportation. Maybe they just are in denial, but there are a lot of reasons why they may not come to the institution. So we learned that we needed to take the message to them. So we went to churches, we went to fairs, we went to cultural events, we went to dances to get the message out. And we know from, as Dr. Sanchez mentioned, from Dr. Victor's work, that if we can partner with our local community leaders, if we can partner with industry, if we can partner with hospitals, we can get hypertension under control. We have the data that shows this is possible. We just have to make the effort. And it takes us thinking outside of the box. We have to think outside of the four walls of the hospital, engage the community, engage the families, engage the community leaders, and we can make a difference.
Thank you. Thank you. Coming from the community impact side, Dr. Blackwell, it's music to my ears. I believe in working within the community, so thank you. And Dr. Sanchez, before we open it up for questions, you get the final question. You heard Kimberly talk a little bit about the stroke registry. Is this something that all states have, and why is this so important to look simultaneously at the launch for Mission Lifeline, while also talking about stroke and hypertension?
So Delaware deserves all the congratulations because not all states have a stroke registry. And what we know, I think I'm hearing my colleagues say, data informs insights and informs action. And sometimes it helps us appreciate what we thought we knew, but sometimes it helps us appreciate that we didn't know what we thought we knew, and it takes us down new and interesting paths. And the degree to which I think, again, Drs. Holmes and Dr. Blackwell would agree, we could bring data to those community partners, the folk themselves, the industry partners, and the non-governmental partners, is the degree to which we could also engage them in beginning to think about interesting ways to approach the solutions with feedback, the feedback loop that says, this worked, this didn't work, this might have worked if we'd have done it that way, and we can do things differently. So again, a stroke registry is step one to a comprehensive plan to use blood pressure control to address stroke management. I would say one more thing, and I bet I'm going to get agreement. What we also need is a blood pressure registry. We need to know in every setting whose blood pressure is higher than it should be. And to what degree did we get it down to where it should be, and what gap is left so that in the clinical care setting, when it's appropriate, but also in the community setting, we can do all the things that get us there.
Thank you very much. Dave, Joe, I'd like to open it up for questions.
Sure, Ernestine. So we had one great question come in through the chat here about what are a couple of steps that our audience, others, their loved ones, can take to actually control hypertension.
I'm going to jump in. Go get your blood pressure taken, and if it's over 130/80, go to see your doctor so that your doctor can confirm what it is that's going on and get you on a plan. I think one of the things that's really, really critical to say is that a little bit of blood pressure that's high or blood pressure that's a little bit high is not a thing to ignore. It is doing its damage to all those organs that Dr. Blackwell spoke about earlier. And I can't leave tonight without saying every single person on this call and anyone you know, go get a flu vaccine. If you didn't get it today, get it tomorrow. Go get a flu vaccine. It is a message from the American Heart Association. It is one way to keep from getting the flu and from having the flu cause a bad outcome like another stroke, a heart attack, or hospitalization. Get a flu vaccine. Go get your blood pressure. Take a friend so that person can get their blood pressure taken and then act accordingly. 130/80 or above, go do something.
That's great, Dr. Sanchez, thank you. Another question that we received is that heart disease is the leading cause of death amongst women. Despite the impact of cardiovascular disease on mortality among women, the level of awareness seems to be pretty poor. What if any of it, does our panel have recommendations to ensure that we're educating and providing outreach for women or other vulnerable groups?
You know, I don't want to be a glutton here, so I'm gonna pause for another second. But first, just say, go red for women, and then I'm gonna let Dr. Holmes or Dr. Blackwell jump in. Maybe it should be hashtag go red for women.
Yes, so Dr. Sanchez, I would absolutely agree with the Go Red for Women initiative. We do wonderful things here in Delaware, once again, with our Go Red initiative. But, you know, one thing I would say, you know, that's an event that happens once a year. You know, I think keeping that momentum alive throughout the year is important. And events that more so target women. I think our, you know, health fairs for now in the pandemic, you know, are on hold, but just, you know, marketing that is targeted and to younger women. I know, and I'm actually an advanced practice nurse, but thank you, Dr. Sanchez. We tend to target our older populations, and we have to begin to talk to young women. We are seeing women and men younger and younger every day. So there is nothing wrong with talking to high school and college, you know, going to our universities and talking to those students about high blood pressure is important. And I think that's, you know, one of the things that we can begin to do is to really target our younger generations.
If I can just join in, I just need to say to everyone listening, heart disease in women presents in many different ways. They may not come to us complaining of the typical chest pain or the elephant sitting on the chest. A lot of times it's fatigue and shortness of breath and just not feeling well. And it gets attributed to taking care of everyone else in the family or working late or working hard, not getting enough sleep, when in reality, it's heart disease. So if you have a loved one and they or she starts complaining of just not feeling well, have them see a physician and have them go through the screening. It doesn't mean they have heart disease, but women just don't present the same way, and we have to be more aware that their complaints might be shortness of breath, fatigue, again, kind of just not feeling well, but we have to look out for them. We have to do that every day that we love them.
Hey, let me jump in and say one thing. Kimberly Holmes, no disrespect meant by calling you a doc. I'm a family physician who learned some of the most important things I learned by working with advanced practice nurses. So thank you for being a part of that family that taught me how to be a better doc. No disrespect meant, I apologize. And oh, by the way, if that's the case, then I hope, Ray, that you wouldn't mind, let's just go to first names, because one of the things that bothers me is that our colleagues don't have a title, and you and I get this fancy title of doctor.
Yes, gentlemen.
So one last question for the panel is self-monitoring is critical to managing hypertension. I know Dr. Sanchez mentioned that, and I think that's actually been important for me personally, just knowing my own numbers. It's been important for managing hypertension, but given the changes with COVID-19, how can we work with patients to ensure proper self-monitoring, considering the coronavirus crisis we're in?
Well, I would jump in and say the coronavirus has actually been the best test case for why self-measured blood pressure is so important, because that can be done at home without having to go to the doctor's office. And if one is in a community where, for the moment or at the time, going to the doctor's office may not be the best idea, the degree to which you have a self-measured blood pressure monitor that's on the validated list, and I'm going to send this information in a moment when I have a second to go find it and put it on the chat box, is the degree to which we can do good blood pressure control management while people are at home. It turns out that when we engage patients in self-measured blood pressure monitoring, blood pressure improves, whether that's the efficacy of being your own agent of care, it comes down. And the important point is the thing I'm going to share so that everyone sees is just 6 weeks ago or so, the American Heart Association, the American Medical Association released a joint scientific statement on the importance of self-measured blood pressure monitoring and the approaches. So that's a great question, David. COVID-19 has actually helped us understand better how unbelievably valuable getting people to measure their blood pressure at home is.
Excellent. Thank you so much. Ernestine, we'll hand it over to you to wrap things up.
Absolutely. Again, thank you, Dr. Sanchez. Thank you, Dr. Blackwell, and thank you, Kimberly, for this very engaging discussion. I really appreciate you. I'm personally grateful for you sharing your time and just how respective your organizations have worked to really minimize the effects of stroke and hypertension throughout your careers. I also appreciate how you're detailing how the AHA looks to transform heart and brain health over the next 3 years, just through some of our collaborative efforts. So thank you. And I was, again, just honored to be able to moderate this panel. Dave, I'll turn it back over to you.
So, Mr. Harvey, if you could maybe take a moment here to kind of summarize a little bit and wrap things up for our audience today as we sort of start to conclude our event.
Be happy to. Can you hear me okay?
We can, sir.
Okay. First, thank you, Ernestine. Thank you, Eduardo, Kimberly, and Ray. See, I gave you all first names. For sharing just how important this campaign is to the state of Delaware. And I'll tell you, I am a testimony to reducing my blood pressure by, and in part, having a cuff that I use here to check it. And I actually took it to my doctor's office and kind of got it calibrated to make sure that it agreed with his machines. I think what that does is raises your self-awareness and just puts it in focus, because hypertension truly is, and blood pressure truly is a silent thing. And if it's very easy for it to be, out of sight, out of mind. And by having that device and by measuring yourself, I think it really does just heighten your awareness and starts you to think a little more in a more focused way about what you can do to help improve your own numbers. I thought this was a great discussion, and I mean that sincerely. I had no idea what to really expect given the technology and all of that, and I really thank everyone involved. The knowledge imparted and the message delivered, I think, is very powerful. Having said that, it's obvious that there's a tremendous amount of work left to be done. Take some solace in knowing that the American Heart Association is bolstering current systems of care through a multi-pronged campaign. And certainly this effort will strengthen Delaware's stroke care system, and the Hypertension Control Network will strive to diminish the effects of the biggest risk factor causing stroke and heart attacks and a multitude of other maladies. But the thing that really becomes sort of crystal clear, or came through tonight's discussion for me, was we need to be involved. And by we, I mean the people who are living in the community, and the leaders of the community. It's our community. It's not up to an organization to do it for us. The doctors and nurses at Christiana and the other hospitals in this state can't just do it for us. They can do it once we become a patient. They can do what they can do, but by then, many times the damage is too great for a healthy, happy return to our former life and lifestyle. To meet the significant health needs of the Delaware community, the Heart Association has a goal of raising $2.3 million to support this 3-year campaign. Robin and I are extremely proud to have made a significant investment in this campaign, and we view it as such. But I also look at it from the business leader point of view, that this community has been darn good to us, and there are a tremendous number of small business people doing really well. And kind of gone are the days of MBNA taking care of a lot of things. Gone are the days of the DuPont family and DuPont company being able to do so many of the things that they did for this state. That said, we have one of the most vibrant, most healthy business climates in the world, not just in the country. And the small and not so small businesses here have the resources to really kick this thing off. And my organization is certainly stepping up. In Delaware, we can make things happen by coming together. And today I ask you to stand with me and stand with Robin and stand with this group of superb healthcare professionals and step up and help out. We want to extend lifespans and health spans for all Delaware residents. That includes us, it includes our families, it includes our employees, it includes our customers. Simply said, I think it's good business to invest in a campaign via financial support and also as a volunteer where we need your voice to strengthen our systems of care and to drive change. And this one item, the hypertension, it's relatively easy in most or many cases, if not the vast majority, certainly in a huge minority of the cases. It's a relatively easy thing to get under control in an individual. But not gotten under control, it does horrendous damage. And in my case, what brought me to focus on this was obviously the impact from a stroke of a dearly loved mother-in-law, which, you know, may sound like a joke. Wait a minute, or your mother-in-law, but you know, she's a dear, sweet woman, and it's heartbreaking to see what has happened. So with that, I ask that in the next week or so, Dave and I will be contacting people, reaching out to more and more people. But I look at $2.3 million as, on the one hand, a lot of money. On the other hand, collectively, not so much money. And when I look at the businesses that are thriving here despite COVID, and some of my businesses are doing terrific, and some of my businesses are having some rougher times. COVID is uneven in the economic effect on different types of businesses. And I understand that some are, some aren't. The ones that stayed through as declared as necessary businesses, which are necessary businesses and which stayed open, continued moving. I think of, you know, construction. I think of the waste hauling business that we own. I think of utilities, publicly and privately held utilities. Those businesses became eligible for PPP money, got to send out bills, got to receive all of their receipts. And quite frankly, there's some businesses that have received windfalls from that. Some other businesses that didn't get anywhere near what it would take. So my point is, despite COVID, I don't see it as an excuse that the business community can use to duck this. I think the resources are here, and I believe the interest should be here, because it's about self-preservation of us, our family, our business, our customers, and our community.
Well said, Tom. Thank you so much. And thank you for sharing why you and Robin have made such a generous investment. Your financial support and your passion for this has launched our campaign, and your leadership is critical to our success. So here's what we heard tonight. There's a significant need to improve heart and brain health in Delaware. Good news is that we have many of the pieces to drive change in place, from health systems to EMS to state government, just to name a few of the key partners. But to take a substantial leap in statewide healthcare, we're going to need to come together. We need everyone's partnership. We see each of you as vital partners to this collaborative effort. And as Tom mentioned, we'll be following up to determine the optimal way for you to participate in this campaign. Thank you all so much for your interest in transforming heart and brain health, and for your time tonight. And Tom and I look forward to speaking with you soon. Thank you, everyone.
Thank you, everyone.